Hi, Mr. Anderson. It's Dr. Buford from here with Mitzi. We're just getting started on the left shoulder. We're going to focus the camera. This is our first look inside here. And this is the torn biceps tendon. You can see it's torn pretty significantly. We're just trying to clear off some of the tissue so we can get a second cannula in the front here. And then we'll start our review of the anatomy and identify everything that needs to be repaired. So I think for now that's pretty good. Let me see if spinal ring might have it. Shoving to the left. Focus it here. We'll get the second cannula and show you some more in a minute here. Okay, what we're trying to do here is to pass a stitch around the biceps just to keep it from retracting before we have a chance to repair it. Using this needle, and then in a minute we're going to pass that white suture back through. Gives us as good a hold on the biceps as we can get here. Now we'll take a pair of scissors and cut the biceps at its anchor. So we'll get this done, show you some more in a minute. So now the biceps is released and we can clean off a little bit more and see what's going on here a little bit better. This is part of the torn rotator cuff. We'll look up here where the cuff is torn away from the bone. Alright, so we've got our work cut out for us there as well. Now we'll look down at the interval, rotator interval right up here. We'll see if we can identify any of the subscapularis tendon here. Okay, what we're showing you here is we're cleaning off the part of the humerus called the lesser tuberosity. The subscapularis part of the rotator cuff's to the right of that. And we're going to have to place some suture anchors in to try and reattach it back down. Let me give you the overall picture. Here we are looking into the joint, which obviously has a lot of arthritis in it. And we're just going to try and place this subscapularis tendon back down right about here. Okay, there's not a lot to show on the video, but We're still working on the subscapularis part of this rotator cuff tear. You'll see a knot pusher come down. There it is there. We're going to tie a knot right here. So we'll get this tight, show you some more in a little bit. Okay, here you can see we're about 1/3 of the way done, but you can see how that leading edge of the subscap is starting to look a lot better. You can see our sutures that are remaining and haven't been tied yet. Let me see a pincher tool, please. So we will pull the next set of sutures out and get these passed and show you some more in a minute. Pause, please. I've repaired. Got a nice solid repair, tight repair. 3 strong sutures and an anchor, and that looks better in the front. You've got to work on the supraspinatus now, so we're going to change positions with your shoulder in just a minute after we finish smoothing out some of the torn labrum that we're looking at here. Okay, so we'll go off on the video and show you some more in a little bit. Pause. So we're showing you now, we're just taking off what's left of this bone spur at the front of your shoulder. You had a very large spur touching the rotator cuff, probably in some part responsible for the tearing that's happened, but it's gone now, so that can't cause that problem anymore. So that's now taken care of. Your clavicle's right here. We're going to sweep underneath it a little bit more and make sure that it also isn't going to be a potential problem going forward. Here in the supraspinatus part of the rotator cuff, here we're looking down into the joint. Let's see if I can show you here. That's down into the joint. And we're trying to identify the margins of the tear, which I think we've done now. We'll go off in the video and show you some more in a little bit. So this needle is marking the angle that we're going to insert our suture anchor at. So that looks pretty good. Now into that same hole that we've just made, we're going to place this screw. Push it in. Now you can see we've got 3 sutures coming from the anchor. We're going to reach in here from the front and decide which sutures we're going to work with first. Looks like we want the blue one first because that's the one farthest to the right. So we'll reach in the front here and grab this blue suture, just like that. Okay, we'll show you some more in a little bit. Pause, please. Can you turn this up? 64. Okay, we're going to go ahead and pull back on the relay, and that's going to bring that blue and white suture 2 degrees higher. And that looks good, and now we'll reach in and get the partner blue and white suture. To save ourselves a step, we're going to decide which suture's next. Looks like the white one, so we'll take this one out this way. Suture up this way. Great, and now we're ready to go ahead and do the white suture. some more a little bit. Stitch in the front of this tear, and this will be the final stitch. You can see us poking through there. Feed that black wire. That's called the super shuttle. Okay. We'll get this passed and start tying these sutures and show you some more in a little bit. Okay, we're getting ready to start tying these sutures from right to left on the screen, which is from posterior to anterior. So the first one's going to be this blue and white striped suture that you see. Okay, so pull this knot down into position and you'll see it tighten things up there. There it goes. And that looks pretty good. Next one should be this white suture. Okay, we'll show you some more a little bit. Okay, we're just finishing the second knot. We're going to go ahead and clip the suture tails in just a minute here. Okay. And now we've got one more to tie. Okay, we're just tying the final suture. This one's for the biceps tendon. And after tying this, we'll be finished and we'll be getting you back to the recovery room. So we've obviously had to do a lot of work here. You've got a significant tear in 2 major rotator cuff tendons, and now we've got the biceps tendon also. So you've got 3 tendons we worked on today, plus you've got some arthritis in the joint. So I really hope this does the trick for you and takes care of the pain and gives you some of that shoulder strength back that we were talking about. So we will finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye. Oh, hold on one second. Can you scroll over? Let me cut this and then we'll scroll over and look to the rotator cuff repair. Let me see the katana after this one. Okay, so that's the biceps. Now the rotator cuff repair is right here. So as you rotate the shoulder, you can see the rotator cuff repair. And that looks great. So we're going to have one more look around, but I think otherwise we're done. And we'll get you back to the recovery room shortly. Bye-bye. Pause, please.